Hannah, lots of frustrations and challenges tracking down people potentially exposed to COVID-19. Federal health authorities today talked about the lack of participation by patients, and Travis County says many health records are still being faxed, not electronically shared, and that forces volunteers to have to dig for information. All the comforts of home are all Rachel Clear needs to be a medical detective.
My very first day on the job, there were only 3 of us in the office, and it was the day that we learned about the flight from Cabo where all the UT students got infected.
Since March, she's worked as a contact tracing volunteer coordinator with UT Dell Medical School. There are now hundreds of volunteers just like her.
We asked them who they were in contact with for an extended period of time, which by our standards is 15 minutes or longer in a closer than 6 feet of range during their infectious period.
The emotions are real.
It can range from people being embarrassed because they were out and about and they have so many different contacts, or people being frustrated because they feel like they were doing everything right and they still got sick.
As states begin to reopen, the challenges for contact tracers becomes greater. Studies show 50 to 70% of patients don't participate in the process, and people are out and about more.
During our shelter-in-place order, when most people were staying home from work and from social activities, almost all of the contacts that were provided to us were household contacts. And now we're seeing a lot more of community and social contacts. For example, you have somebody who went to a baby shower or somebody who went to a graduation party, and then you have all of those people who were also in contact with the individual who contracted COVID-19.
As life changes around us, Rachel hopes we recognize we're in this together.
It has definitely been a roller coaster.